The Centers for Disease Control has created a new program specifically for patients who are pre-diabetic or at risk for type 2 diabetes. And Bay Area residents can participate in this program for free. It is a 16-week program and it's being offered by Tampa General Hospital. It starts next month and goes through the middle of December at 2 locations in South Tampa and also in New Tampa. And participants must pre-register, so that means that now is the time to do this. Joining us in our studio with more, we want to welcome the Community Relations Manager for Tampa General Hospital, Mary Jane Harrington. Thank you very much for coming in.
Thank you for having me.
Pre-diabetes, you know, what is that? How do you explain that to people?
Yeah, it's a relatively new term that not a lot of people are familiar or comfortable with, but basically it is when you become at risk for developing diabetes. And it is closely associated with the rising level of obesity rates in the United States. We develop diabetes when let's say, when we eat something, our body converts our body converts the food into different types of components. One of those is glucose or blood sugar. Okay, so blood sugar is used to go into the cells and create energy in our bodies, but it doesn't immediately do so. It has this little gatekeeper in front of the cell called insulin, and insulin has to allow the blood sugar or glucose into the cell in order for it to be converted into energy. When we don't produce enough insulin in our bodies, or we become insulin resistant, then we develop diabetes. There is a point in time when our bodies increase in weight and we become close to becoming obese, that we become at risk for developing diabetes, but we're not quite there yet. We're not producing enough insulin. There's glucose floating around in our bodies that shouldn't be, so our glucose levels are elevated.
Right.
But they're not quite there where they're not getting in at all.
And you're still getting all sorts of other medical problems because things aren't working properly.
Right.
Clearly, these are things that you explain to participants in the programs. But what makes this particular C.D.C. national program on diabetes so exciting to you? So different?
Yes, well, it's the fact that it was an evidence-based program. They studied very heavily in a very large population of people this 16-week program. And what they found was that if patients, or if their class basically lost 5 to 7% of their body weight, their risk of developing diabetes went down significantly.
Wow.
So if we can help people lose the weight before they get to the point that they develop diabetes, then that's what's exciting to us. It is proven to work.
So you're not just talking about weight and exercise, you're talking about reprogramming the way you think about food, the way you think about the drinks that you're intaking. This is kind of like expensive personal trainer kind of thing, and yet you're saying this is for free and it's 16 weeks?
It is. It's free. We really believe in being socially responsible at the hospital and trying to put out information that will help the public so that they don't get sick. And this is one of the the leading causes of death in the United States is diabetes or complications from diabetes.
But participants have to pre-register, and they can't just drop in and out of the program. Once they sign up, they have to do all 16 weeks?
Right, right. Well, we allow some flexibility. You know, there's about a 30% time frame. If you can't make it, we understand, but we want people to show up about 70% of the time, because that's what's proven to work.
Well, thank you for coming in, and we'll make sure that we include more information on our website and our Facebook page on the program.
Okay.
Appreciate you coming in today. Here's the information on your screen. This is an incredible opportunity for our community. This is a national diabetes prevention program created by the C.D.C. and it's being offered here at home by Tampa General Hospital. For all the detailed information on how to sign up, please call 1-800-822-3627.